Fall is fast approaching, and that means flu season is right around the corner. But with the arrival of a new COVID-19 variant and concerns about cases of RSV, there are renewed fears we could be heading towards another triple threat of respiratory viruses. CTV's medical expert, Dr. Marla Shapiro, joins me now with more on that. Good morning, Dr. Marla. Boy, I hate thinking about the fall, but here it is on our doorstep. So what are the main concerns around these three viruses out there?
So when we look at these three, we think of them as either influenza or influenza-like because both RSV and COVID share many of the same symptoms. We often didn't talk about RSV in adults. One, we don't have a really good surveillance system that we can tell what's happening unless you end up in an emergency room, for example, with a respiratory panel where we look for these three things. There's no home testing for RSV, no home testing for flu, and we typically made the diagnosis based on what was circulating. As we saw last year, it was a miserable RSV season, came early, stayed long, and we underestimate the impact that RSV does have in adults and how similar it looks like to the flu, not only in its presentation, but in terms of its complications.
And that sends people to hospital, which is something we want to avoid. What lessons did we learn from last year?
Well, if we first look at the complications in terms of the two, because people think, oh, it's flu is the big thing. But if we look at complications, for example, you start off with an influenza-like illness, a viral illness, but then you get a secondary bacterial event, like a secondary bacterial pneumonia. And you can see that both RSV and flu, they're neck and neck in terms of getting into complications. So often, I think, a lot of what we saw in the fall and winter with adults that we call flu is also RSV, or people who say, I got a flu shot, I still got the flu. Well, maybe you actually got RSV. If we look at things like cardiac complications following one of these illnesses, in fact, you see more cardiac complications with an RSV infection than you do with a flu-like infection or the flu. If you look at readmission, meaning you came into hospital, you're discharged, but then you come back because you represent, again, you can see that RSV and flu are very similar. The good news here is that with these three respiratory pathogens that are facing you in the fall, and all three are going to be there, I promise you, we do have vaccine strategies for all. So that's
for
reassuring.
all of them?
All of them, yeah.
So you need 3 shots?
That is what I'm saying to you.
Dr.
That is what I'm saying to you, yes, that is what I'm saying.
Okay. The flu, RSV, COVID-19, as you have pointed out, show many of the same symptoms. Yes. How do we distinguish between them? Why is it important to distinguish between
lots of reasons to distinguish, but if you look at what the symptoms are of them, you can see that they're very similar. A lot of them have fever associated with it, muscle aches, fatigue, headache, nasal congestion, sore throat, cough and wheeze, shortness of breath, chest pain. Symptoms are, very, very similar. There's maybe a little bit difference in terms of the way they present, where clinically, if you come into the office, I might have a clue that it's one or the other. So the speed with which it appears, whether it's gradual or whether it's sudden in its onset, whether you do have fever, whether you do have muscle aches, there's a little bit of a difference between them. For example, we think of influenza as a very sudden onset, COVID a little bit more gradual, RSV a little bit more gradual. But the truth is that it's very difficult to tell clinically. And it does matter because, for example, if it's COVID-19 and you're in that age group, we'll think about Paxlovid. If you're an influenza-like illness, we'll think about Tamiflu. But the real strategy comes with prevention. The real strategy comes with the fact that we now have an adult vaccine for RSV. We have the adult vaccines for flu over the age of 65, high dose and regular. And we also have the new COVID monovalent that's coming out that's targeting the particular variant that we're seeing. The good news is with RSV and flu, you can give the 2 shots together, so you can co-administer. So, one arm here, one arm here. You can give these vaccines at the same time.
Okay, so one quick final question then. With the RSV vaccine, 18 and up, or what's...
So right now, the RSV is being targeted for age 60 and older.
60 and older.
We don't have guidelines in Canada. It just got approved in Canada. The Americans are basically saying it should be a discussion between you and your healthcare provider. And depending which province you're in, for example, Calgary, Alberta, there a pharmacist can administer it. In the province of Ontario, your primary care doctor is going to administer. So I'm urging my patients, stop counting. Just ask yourself, as the season is approaching, am I up to date with all the strategies I can take? Because really, a shot is way worth the prevention than some of the misery that comes with these illnesses, which really can still be quite serious.
Dr. Marla, thank you so much. Really important information.